Tonight, a serious shortage of mental health providers here in Maine. In fact, according to a new policy report, we have the lowest ratio of psychiatrists to patients in all of New England.
As 8 Investigates digs into the numbers, Chief Investigative Reporter Nora Hogan joining us live in the studio here. So, Nora, what about this stands out to you?
Yeah, well, Megan, John, a few things here. And importantly, according to a new study from this mental health advocacy group, Inseparable, based on the number of licensed psychiatrists in our state, we're only meeting 14.4% of the need for mental health services.
When compared to other New England states, it's significantly harder to find care here.
In the case of Maine, there's a real opportunity there to expand insurance coverage of mental health care and ensure that insurance companies are paying fair wages.
It's difficult to recruit and retain mental health providers, in part because training is expensive and pay doesn't keep pace due to low reimbursement rates from insurance companies. In Maine, for every dollar that a medical clinician earns, psychiatrists only make 76 cents. And for every dollar that a physician assistant makes, therapists earn 63 cents. That drives some providers to leave the industry or go out of network, forcing patients to deal with higher copays or pay out of pocket. One possible solution is adopting policies that require insurance companies to use the same reimbursement rates for mental health care that they do for physical care.
Unfortunately, they're held to different standards. Some states have really strong enforcement mechanisms, in which case states may be fined or required to cover out-of-network care.
But on the bright side, Maine is making progress. The state has implemented some policies that help with retention and recruitment, like student loan reimbursement programs, and membership in a number of interstate compacts that allow psychiatrists and counselors to transfer their licenses to Maine.
This workforce shortage is not inevitable. It really is a result of policy misalignment and insurance practices that cause providers to leave the network. That being said, there is hope, there is opportunity.
And when we look at some possible reforms, Illinois enacted a law that sets a minimum reimbursement rate for mental health services. While they're still facing a shortage, they're closer to pay parity, and fewer patients have to go out of network for treatment. In studio, I'm Nora Hogan for 8 Investigates.